Dear students, very good morning to everybody. Hope you all are staying safe and healthy. We are continuing with the previous topic about assisted reproductive technologies or ART. Some important assisted reproductive technologies are test tube baby, IVF ET, in vitro fertilization and embryo transfer, artificial insemination technique AIT, gamete intrafallopian transfer, gift GIFT, intracytoplasmic sperm injection ICSI. Out of these, we have discussed about test tube baby IVF ET in our previous offline class. Do you know about the first test tube baby? Let's have some introduction about first test tube baby. First test tube baby, Lois Joy Brown, born to Leslie and Gilbert Brown on July 25, 1978 in Oldham, Lancashire, England, with the help of Dr. Robert Edwards and Dr. Patrick Steptoe. Dr. Edwards got the Nobel Prize in 2010 for this technique. India's first test tube baby was born on August 6, 1986 at KEM Hospital, Mumbai. KEM, King Edward's Memorial Hospital, Mumbai. Her name is Harsha, now changed as Kanupriya Agarwal. Credit for this goes to Dr. Indra Hinduja. Some persons claim that Asia's first and world's second test tube baby was born in Kolkata on October 3, 1978. Previously, her name was Durga, now Kanu Priya Agarwal. Pioneering effort was of Dr. Subhash Mukherjee. Now we have the second or technique, that is artificial insemination, abbreviated as AI, artificial insemination AI. What is artificial insemination? In this technique, the sperms from husband or donor are artificially introduced either into the vagina or into the uterus, IUI, intrauterus insemination of the female. It is done in infertility cases either due to inability of male partner to copulate or due to low sperm count, which is called oligospermia. During ovulation, about 0.3 ml of washed and concentrated semen having at least 1 million sperms are artificially introduced through a flexible catheter into the vagina or into uterus, IUI. Washing removes the proteins and prostaglandins from the semen. The procedure is repeated 2 to 3 times over a period of 3 days. A result of artificial insemination or AI is 20 to 40%. If husband's sperms are defective, AID, that is artificial insemination donor method, is used. Now we have another or technique, that is gamete intrafallopian transfer or gift GIFT. The technique was first attempted by Steptoe and Edwards and later pioneered by Ricardo Osh in 1984. Gift technique is more expensive and invasive than IVF, in vitro fertilization, but with better results. Gift requires normal fallopian tubes. In this technique or in this technology, two oocytes along with 2 to 5 million motile sperms are placed in a plastic tube container, then transferred through laparoscope and inserted 4 centimeter into the distal end of the fallopian tube or oviduct where the combination is injected. A result of this technique, that is gift gamete intrafallopian transfer, is about 27 to 30%. Now another odd technique is intracytoplasmic sperm injection, ICSI. ICSI technique was described by Van Stuttergam and colleagues in Belgium in 1992. In this technique, sperms are obtained through ejaculation. Sperms can be recovered by TESE, testicular sperm extraction, TESE, or by MESA, micro surgical epididymal sperm aspiration. One single sperm, even a spermatid, is directly injected into the cytoplasm of an oocyte by micropuncture of the zona pellucida. Micropipette is used to hold the oocyte while the sperm is injected inside the cytoplasm of oocyte, that is ooplasm, by an injecting pipette. Fertilization rate through ICSI is about 60 to 70%. However, pregnancy rate is 20 to 40%. Now another technique, that is ZIFT, zygote intrafallopian transfer. In this technique, zygote or early embryo with up to 8 blastomeres is transferred into fallopian tube. Then we have IUT, intrauterine transfer. If the embryo is with more than 8 blastomeres, it is transferred from the laboratory to the uterus to complete its further development. Now, surrogate mother. What is surrogate mother? A woman who bears a child on behalf of another woman, either from her own egg fertilized by the other woman's partner or from the implantation in her uterus of a fertilized egg from the other woman. A developing embryo is implanted in the uterus of another female to complete its further development. So, a woman who substitutes or takes the place of real mother to nurse the embryo is called surrogate mother, and this phenomenon is called surrogacy. This was all about this art technologies. Thanks. Have a nice day.